welcome to diabetesplan.org, where we focus on the what you need to know and what you need to do so you can take better care of your diabetes. I'm Dr. Ricky Bass, and today we're going to talk about hypoglycemia, or what happens when your blood sugar gets too low. You may have also heard this called an insulin reaction, but importantly, hypoglycemia can also occur with the oral medications that we use to treat type 2 diabetes, so it doesn't just occur with insulin. So what are the symptoms and signs of hypoglycemia? Hypoglycemia can manifest itself in many ways, so you need to make sure that you're aware of all of these. Additionally, different patients have different signs and symptoms, maybe even some that aren't on this list. You need to make sure that you understand your own signs and symptoms of hypoglycemia so that you can take action. Some of the signs and symptoms of hypoglycemia include shakiness or jitteriness, breaking out into a cold sweat, experiencing chills or clamminess, nervousness or anxiety, being more irritable and impatient than normal, being confused or having difficulty concentrating or completing certain tasks, a rapid or fast heart rate, lightheadedness, dizziness, hunger and nausea. When you experience hypoglycemia, you may be more sleepy than usual. You may also have impaired or blurred vision. You may experience tingling or numbness around the lips or the tongue. You can experience headache, weakness, or fatigue. You may have a lack of coordination and experience difficulty completing tasks that would normally be easy for you to do. Patients with hypoglycemia report nightmares and crying out during sleep. You can also experience seizures or unconsciousness. The only way that you can know for sure whether you're experiencing hypoglycemia is to check your blood glucose. However, this is very important. If you're experiencing symptoms that you think might be hypoglycemia and you're not able to check your blood glucose for any reason, then you need to treat your hypoglycemia. As I said earlier, severe hypoglycemia has the potential to cause accidents, injuries, and even death. Make sure that you take action. Well, so how can I treat hypoglycemia if it occurs? Well, first, you need to make sure that you speak with your healthcare provider about how he or she wants you to do this. The advice that I'm going to give you now is just one way that you can treat hypoglycemia. So you want to consume 15 to 20 grams of a glucose or simple carbohydrate. You then want to recheck your blood glucose after about 15 minutes. If hypoglycemia continues, then you need to repeat it. You also need to talk to your healthcare provider about when you should go to the emergency room or seek care. Once your blood glucose returns to normal, you need to make sure that you eat a small snack if your next planned meal or snack is more than an hour away. So you can get the 15 grams of carbohydrates or simple sugar in any of the following methods. You can get glucose tablets from the pharmacy, and the package instructions will tell you how to get the 15 grams. Similarly, there's a glucose gel tube that you can use and get from the pharmacy and follow the instructions. 2 teaspoons of raisins, 4 ounces or about a half a cup of juice or regular soda will treat hypoglycemia. You need to make sure that you don't use diet soda, as this doesn't contain sugar. A tablespoon of sugar or corn syrup, or 8 ounces of non-fat or 1% milk. Hard candies or jelly beans can also use to do this. You need to look at the package insert to see how much sugar is in them and know how many to consume. It's also a good idea that you know this before your blood sugar gets low. As we said, you may experience difficulty in concentrating to be able to do this. Next, I want to mention glucagon. As I mentioned earlier, if untreated, hypoglycemia can lead to a seizure or unconsciousness. In this case, someone else is going to have to take over for you. It's a good idea for you to let coworkers, teachers, or family members know that you have diabetes and what to do if you begin experiencing symptoms of hypoglycemia, especially if you become unconscious or have a seizure. Now, glucagon is a hormone that stimulates your liver to release stored glucose into your bloodstream when your glucose levels are too low. Your doctor can prescribe injectable glucagon kits that are used to treat someone with diabetes that's become unconscious or had a severe insulin reaction. As I said, they're only available by prescription, so you will need to speak with your healthcare provider about whether or not you need one, and then also get instructions on how and when to use it. The people that you're in frequent contact with, again, family members, significant others, and coworkers, should also have some instructions on how to administer glucagon and treat severe hypoglycemic events. All of these people need to know that they need to call 911 if they feel like they can't handle the situation. So for example, if you get hypoglycemic and pass out, or if you do pass out and you get the glucagon and you don't regain consciousness, or if you have a seizure, or if you don't know how to inject the glucagon, or it's not available, for any of these things, these types of people need to call 911 to get you help. Well, I hope you've learned a little bit about hypoglycemia, its symptoms, and how to deal with it. You can sign up for our mailing list at diabetesplain.org so that you can learn more about what you need to know and what you need to do to take care of your diabetes.